Well, ladies and gentlemen, thank you very much for coming along, and it's my pleasure to introduce to you, introduce you to our Health Minister, Yvette D'Ath. Yvette, thank you very much for coming up here to Toowoomba to make this important announcement. Thank you.
Thanks, Mike. And it's wonderful to be joining the Chief Executive from Darling Downs Hospital and Health Service, Annette Scott, and of course the Board Chair, Mike Horan, here, and I have the Director General, Sean Drummond. And we're here on the site where we are building one of 3 new hospitals across Queensland. Here at Toowoomba, there will be a new hospital, 118 additional beds, $1.3 billion investment. This is in addition to the new hospital we're building at Bundaberg and of course the new hospital at Coomera. We are also expanding 11 other existing hospitals and building up to 5 to 7 new rural and remote health facilities every year over the next 5 years. And so this is an exciting step forward because Hutchinson Builders have been awarded the contract to do the early works here, $11.5 million as part of that $1.3 billion project. What that means is very shortly the community will see work starting for a new access road into the hospital. Also those essential services, so stormwater, water, power, telecommunications, having all of that essential infrastructure in place for the big star of the hospital. Now we expect in April this year to be announcing the contractor who will be constructing the hospital itself, and for those works to start next year, and of course for the completion of the new Toowoomba Hospital in late 2027. This project alone will support over 3,000 jobs for this region, which is absolutely extraordinary. But once the project is completed and this hospital is open, we know it's going to help take pressure off our public health system and make our public hospitals much more accessible to the community, allowing us to separate our planned care from our emergency care. And by doing so and having here on site our emergency department and our overnight beds and theatres will allow us to, by separating those, mean that we won't have as much disruption to our elective surgery by emergencies that come in our door. We know that our presentations in our emergency departments, around 1/3 of all of the presentations who come into our emergency department, both walk in and arrive by ambulance, end up needing a hospital bed. And so it's really important that we invest in those beds, and that is why we are committing to almost $10 billion of investment over the next 6 years, and 2,509 extra hospital beds over those years. So I want to thank the Darling Downs Hospital and Health Service Board and the Chief Executive and all of their team and the health workers here in the Darling Downs for the great work they do. Of course, this project is on top of the $42 million new day surgery that's being built here on site at Bailey Henderson, which we completed later this year, and of course the new Kingaroy Hospital, and we're replacing the Tara and Millmerran health facilities as well. So there's a lot going on in the health space in this region. I'll hand over to Mike to say a few words, and then I'm happy to take some questions.
Thanks very much, Minister. And look, on behalf of the Darling Downs Hospital and Health Service, I'd like to thank you and the Premier for the work that's gone into getting this funding. $1.3 billion is a huge amount of money, and as well as getting the brand new hospital here as part of the arrangement, we are continuing to keep the CBD hospital site, so the future potential of that for planned care, 9 to 5 and other research and teaching facilities is huge. So it's a huge commitment, and we're very, very grateful. The early plans for this hospital are exciting, and it's going to be an enormous boost, not only to Toowoomba, but to the Darling Downs, the Western Downs and the South Burnett. So thank you very much for that support.
Questions?
In August, announcing the early enabling works here on site. What's happened between now and then?
So here we were talking about the day surgery clinic, and as I say, there's been a lot of planning. We had back then gone out to tender We've obviously selected that provider, being Hutchinson Builder, and now they can get underway. So we see plant that's starting to move on site now, and capacity to hold, eventually 3,000 workers coming in and out of this project over 4 years. It's hard to believe that in 4 years' time we'll be standing here next to a brand new hospital. So lots being done, and when we announce the new provider who will be building the hospital in April, then the work will be done in finalising that business case, getting the project management in place and getting that construction started.
You mentioned the Tara Hospital development. There has been a petition of some residents who are concerned about where it's going to be built with flood modelling and other concerns. That's been sent to you now. What do you say to those concerns about the development?
I know that they looked at the sites, they've looked at the flood modelling. I've been assured that the place, the site that has been chosen is the appropriate site for this health facility. And, I think, this is critical to this community. I've seen what our new health facilities can provide to those communities, and I'd hope that the community will get on board and be supportive of this new facility and see it operational as quickly as possible.
On elective surgery wait lists, in Toowoomba we're seeing them soar by 26%, 34% in Bundaberg, 51% in Nambour in just a year. What are you doing to reduce this, and is it a concern?
Look, of course we are doing everything we can to improve on our emergency department times. Although our emergency department presentations, we're leading the country in those turnaround times. We are leading the country when it comes to elective surgery and seeing elective surgery patients within recommended time. We have the best results in the country right now. Now, of course, we have seen an increase in the number of people waiting for outpatients and elective surgery over the last 12 months. I've seen the comments from the LNP today. I find it extraordinary when they say there's been a blowout in elective surgery over the last 12 months without actually acknowledging what's happened over the last 12 months. The LNP must be the only people in this country and globally who aren't aware what's happened throughout 2022. When you compare our performance data that we just issued of the quarter at the end of 2021, when our borders were closed, compared to 2022, when COVID was rampant throughout our community, we had multiple suspensions of elective surgery. We had 4 waves of COVID, and then the LNP go, oh my gosh, shock. There's been a blowout in elective surgery. I mean, how naive are they? Or are they just playing pure politics? I suspect it's the latter. The reality is that our health service over the last quarter has seen a 6% increase in the amount of elective surgery. So I stand here today saying thank you. Thank you to every one of our hospital and health services who have helped us do a 6% more elective surgery over that last quarter, despite we had a 4th wave of COVID. So they did exceptionally well. They continue to do exceptionally well. Compared to the rest of the country, we are punching above our weight in relation to our wait times for emergency departments and our elective surgery. And even the AMA's report shows that although our population makes up 20% of the country, we only make up 10% of those waiting longer than they should be. So AMA have recognised that, and we would ask the LNP to actually have a little bit more self-awareness about what's been going on and acknowledge the tremendous work of our health workers, because it was actually Lawrence Bringboard that said that when you continually talk down our hospitals and our health services, it's very hard to attract and retain people to want to work in those services. So it's about time the LNP and David Crisafulli as the leader, Ros Bates as their shadow health spokesperson, stop criticising the services that we're delivering and start saying thank you.
Minister, more than 1,000 patients with opioid dependence have been left without treatment after their GP closed. What is the state government doing to help them?
So I understand there's been consultation and work being done across Queensland Health on this. The problem is this, that as I understand it, and I'm getting an update on this, but as I understand it, that this GP has not handed over the details of these patients. Now, that being the case, Queensland Health is trying to put in place contingency measures and working with the primary healthcare sector, but they're doing it without actually knowledge of where these people are and how many people there are that may come forward and provide needing service. So certainly anyone who comes forward to any of our health facilities will continue to get that. I've recently been talking about the great work that we're doing in rolling out the $1.6 million over the next 5 years as part of our announcement around mental health, alcohol and other drug services. So we're certainly putting a lot of money into this area, but this story today just shines another light on the fact that every failing in the primary care sector has a flow-on effect to the public health sector. We're left to mop up those deficiencies and those market failures. And so we're working with the Commonwealth, and I do want to acknowledge and say, while I stand here in Toowoomba, thank you to the Albanese Labor government and Minister Mark Butler, because last week he signed off on 2 additional urgent care clinics in Queensland beyond the announcement that was made at the federal election. Those 2 clinics include one here in Toowoomba. That means people being accessing bulk billing 7 days a week, 8 a.m. to 10 p.m. at night. And we know that there is a lot less accessible and affordable GPs out there in the community right now, that this clinic is going to be welcomed by the community.
On that thing,
the CSIRO has just come out with a report today asking both state and Australia-wide to help stop the overprescription of antibiotics by doctors because of spreading antimicrobial resistance. Is there anything the state government can do in helping GPs?
Look, I know this has been a discussion for some time across the medical profession. This is something that should be led by the medical profession, not by government or politicians around any changes around this. It should be a national discussion, and it needs to be a national decision. So any changes around that would have to come from national regulatory bodies and the medical profession themselves.
An internal Queensland Health report says state addiction clinics have been at or over capacity for many years. Given treatment can save lives, why hasn't the state government done more? And also, Michael Berkman and Amy McMahon wrote to you about this issue a week ago and have urged the state government to increase funding for opioid substitution treatments in the upcoming budget. Will you?
Look, I welcome the Greens playing catch-up. The fact is, we committed to $1.6 billion last year as far as mental health, alcohol and other drug services. So, if they want to come on board and support our commitment, that's fantastic. We are opening new mental health and drug and alcohol facilities. We've got a number of them being built. We've already opened some. We've got others being built and others to be built. As part of our $1.6 billion, we also have additional capital funding for building infrastructure around these services. But I want to be clear, while we're doing this, that is not the only solution in dealing with drug and alcohol use and also mental health. And often they go hand in hand, and they go hand in hand with housing and homelessness as well. You actually have to look at what can we do to be providing support in the community so people don't end up acute and needing to be hospitalised. That is your ultimate aim, to keep people out of emergency departments, to keep people out of facilities needing overnight accommodation for those services. Now, sometimes that will be needed, and that's why we are building those acute settings. But we're doing a lot more in the community as well. And I'm very proud of the work that we are doing in that space, one of those being the mental health co-responder model with the Queensland Ambulance Service. That is seeing about 70% of people being diverted away from an emergency department when they are having an episode. So that's really good news. There's always more work to be done, and we are working with the Commonwealth in this space as well, because again, when we talk about drug and alcohol addiction and mental health, these are national issues that we all need to deal with, and we do have a significant workforce shortage in this space as well.
Where's the government at in its three-phase plan to return maternity services to Chinchilla?
Exactly where I announced last month and the month before that. The situation is we delivered stage 1 last year. We've gone to stage 2, which means that we now have a locum on board to do with emergency deliveries. Stage 3 is bringing all of those services back on. So, of course, planned caesareans are already available, emergency caesareans, bringing the full services. We're looking around this middle of this year because we are securing 4 additional doctors. We need 10 FTEs across Gladstone and Bundaberg. We've said this has got to be a rotational system. So the days of just having them...
Minister, is it Chinchilla or Gladstone you're talking
Sorry,
about?
I thought you were... Well, the 3 phases are Gladstone.
I think
So-
I said Chinchilla.
Oh, well, the 3 phases aren't Chinchilla, they're Gladstone. So those are the 3 stages.
Where are we at with returning services to Chinchilla then?
My understanding is that Chinchilla's always been a hospital where low-risk births are provided. And they have a maternity midwifery practice that has been implemented there. That is my understanding. Those women who have to travel away from Chinchilla to have their baby is because they are deemed a high-risk birth. That has always been the case. That continues to be the base. So anyone who says that full service is delivering all babies at Chinchilla, no matter what the risk level is, and returning them, that hasn't been their practice in recent years, and they're being misleading to the community.
Just to clarify with elective surgeries, Crisafulli does say that 41% Category 2 wait times does make us the worst in the nation. Is that true? And we're seeing the data show that the long-term trend
No, it's not
is that
true.
it will get
It's
worse.
not true. So I would ask you to challenge David Crisafulli to show you where he's getting results. My results are coming from the report on government services, public document, Commonwealth website, the Australian Institute of Health and Wellbeing, Commonwealth data, publicly available, Queensland performance data, publicly available. Now, I know he's made these accusations in state parliament. He's been challenged on those accusations. The explanation they gave is they've gone away and they've done their own calculation with their own formula that doesn't exist in any public arena and come up with their own outcome. Stop talking our health system down. We know there's challenges. Everyone knows there's challenges on the health system in Queensland, nationally and globally. The national health system in the UK has 96,000 vacancies right now. This is a global challenge for everyone. But for them to keep talking our system down and saying we're the worst in the country, it's shameless. And I can't believe Ros Bates, who loves to throw around that she's a health professional, even though she's not a practicing registered nurse. The fact is, it is shameful that she constantly talks our system down. David Crisafulli said he'd be a leader who would acknowledge good work when it's done. Then why is it when we have an improvement in our health system, he isn't saying that's great work for our health workers? Because it is criticising the ones who deliver that service.
So there's not a long-term trend that elective surgeries and ramping will get worse?
Well, I've seen the reports today about the last 10 years and the growth in ramping, for example, over the 10 years. When you compare to the growth in the population, you'll find they match. We've had actually growth in population. We've had a decrease in private health. In fact, we've had the lowest private health take-up in 20 years. People who have private health insurance are walking into our public hospitals and utilising our hospitals for elective surgery, even though they have private health insurance, because the private health insurance, the facilities, the services aren't there in the community. We have an ageing population. We have increased comorbidities, and these are all challenges. And on top of that, we have a failing GP sector where people cannot afford to go and get access to good health care, and they are not getting the care they need, which means their conditions are becoming complex, and that means longer stays in hospital. And in addition to that, we have between 500 and 600 people still today that are long stays who are either aged care or disability, who are living in our hospitals even though they don't need medical care. So that's the complexity, and David Crisafulli and Ros Bates should stop making out as if there's one quick fix, because their 4-point plan has no dollars, no staff, no new hospitals, no ideas.
Minister, back to the Gladstone maternity issue, so Gladstone this time.
Yes.
Why haven't, given what happened up in Mackay, you issued that show cause notice to the board up, the health service board up there, why haven't you issued a show cause notice to the Central Queensland Hospital and Health Service Board, and will you?
Well, because the circumstances in Gladstone haven't come about because of the failings in the healthcare that was specifically delivered to individuals. Sorry, no, it wasn't poor planning. There is all the planning for workforce needs and future FTEs is done throughout the years. And the fact is, the reason why we have the highest intake of intern doctors this year is because it was planned for 6 years ago. The only reason we have extra doctors this year coming into the system is because 6 years ago there was that planning to increase the number of doctors we were going to need. There is a whole lot of circumstances around why the doctors who were working at Gladstone, the obstetricians, are no longer available. Their personal circumstances, there's a range of reasons why they then left that service. And that stuff couldn't have been planned for. To have so many, for all different reasons, ending up needing to leave all at the same time just caused the perfect storm as far as not having that workforce. But it also happened at a time when we have a national shortage of obstetricians. So being able to turn around and quickly get an obstetrician to relocate from somewhere else, either within the state or nationally, or for that matter to bring in locums, just wasn't available. And we are competing with everyone else around the country trying to get these obstetricians, and we weren't able to bring in any international doctors for over 2 years. So that has had an impact. So to say we should have planned for a global health pandemic, we should have known that our international borders that have never been shut, from my knowledge, were going to be shut for 2 years. We weren't going to be able to get any international doctors, and that this would happen. I think it would have been a very, very clever person to have foresaw all of that happening.
Talking about clever people, you've got the workforce summit, the maternity workforce summit this Thursday. What are you hoping comes out of that, and what will be your contribution to it?
Look, I want to thank all the stakeholders who are coming along to this forum. I think it's really important that we have a conversation around women's health workforce, particularly around maternity services. That's what this particular forum is about. What I'm hoping is some additional ideas, thinking outside the box as to what we can do to get services open, but open safely. It is not okay to just go open the service, even if you've got less doctors than is safe. We need to make sure this is safe for birthing mothers. And so I'm hoping that we're getting new ideas. A lot of the stakeholders, a lot of our peak professional bodies all have opinions on what we should be doing. Bring those opinions to the table, but also bring solutions. What can we do to overcome the challenges when we have less obstetricians and gynecologists leaving their training and wanting to actually practice in obstetrics? We've got a reduction in the ones who are wanting to practice in obstetrics. We've got less who are wanting to do the days and hours that are available. We've got a shortage of nurses and midwives. How do we deal with these challenges and make sure that the women in Queensland have the opportunity to birth at the hospitals that are equipped to deliver those births safely?
Staff shortages have been a concern for quite some time. With this new hospital coming in, more beds, more services, how are we looking to fill those roles when we're struggling to fill the roles in the hospital we've got now?
So we're developing a workforce strategy right now as to how we boost those numbers. So there's short, medium and long-term solutions here. How do we bring in more nurses, maybe registered nurses while they're doing their study to, enrolled nurses to become registered nurses? What other roles? Scope of practice is really important, including, our intern doctors, all of those physician assistants. We need to look at all of those roles. So those are the things that we're looking at the short term, which is what the National Cabinet said as well from the Medicare Task Force report. We've got to look at full scope and people being able to practice to their full potential and their training. We're also looking at what can we do to open up more pipelines of people coming out of the university. So we're talking with the universities about placements. We're talking with the Commonwealth about how many placements they actually provide for medical students. So we want a lot more placements for medical students in Queensland. Bottom line, we want a lot more. And then we're talking to the colleges about accreditation. How do we make this a much more streamlined process to get accreditation into our hospitals as quickly as possible? We're also looking at international migration. So we're talking to the Commonwealth about, and the colleges about getting international health professionals, whether it's doctors, whether it's nurses, midwives, specialists. How do we get them in and make sure that they're able to walk straight in and start practicing as quickly as possible? Breaking down those barriers. Some of that includes giving them accreditation while they're still in their original country. And we've got nurses who, many of them, are already accredited to practice in Queensland and in Australia, so that all they've got to do is get on a plane, and we support them in accommodation and actually establishment, and they could be working here right now. So those are some of the things that we're talking about.
Are there struggles actually getting people, though, to become specialists in the first place? Because I know in The Guardian the other day, Ranscog were quoted as saying that people aren't even wanting to become GP obstetricians, and there's a shortage of that as well.
Absolutely. So my understanding is for a GP to become a GP obstetrician, there's an additional 12-month study. I'm really keen to see and have a conversation with the Commonwealth about how we incentivise that. We'd love to see more GP surgeons, GP obstetricians, GP anaesthetists, because that's what's going to be needed in the regions and more remote communities. Our rural generalists, we need a lot more of those because we know that we just don't have the same number of people coming out of their training wanting to practice solely in those professions. So if we can have the best of both worlds, where they can be a GP in their local community and come work in the public system as well and rotate through, then we'll have a much better sustainable model for our health workforce going into the future.
Back to the Toowoomba Hospital, these 3,000 local jobs, that sounds exciting, but can you define local? Hutchinson Builders have an office here, but are people going to be driving in from Brisbane, Springfield?
So there's a requirement as part of our government procurement processes that a priority is given to local jobs and local businesses. So it's not just local workers, but it's local suppliers as well. So we want to be able to support local businesses in the supply of the materials that are going to be needed for, you know, this state-of-the-art hospital facility. So there's a component that they must include in that. If they do not meet that component, they have to justify to government why they haven't and what efforts they've made to try to find, you know, locals who can provide that. Now, they won't always find the relevant skills that they need, but they first and foremost have to go to the local region, and if they don't meet that, they actually have to show to government why.
So that's the Darling Downs or Toowoomba? What's local?
Well, my understanding it will be the Darling Downs, but a lot of it will be, you know, I've been to so many little towns where it's local little businesses that have all been able to step in and help to, you know, all profit, because that helps them employ people as well. There's also a really important component as part of that procurement on apprentices, and making sure that we've got apprentices on these jobs so that we're actually training up the future workforce as far as our tradies that we need.
Is it true that Callide is literally doesn't have any active maternity wards across its 14 hospitals? And if so, how soon till somebody can actually have a baby in at least one of those maternity wards?
Look, I'm happy to get the Hospital and Health Service to specific talk about that, that region, but we have to remember that to deliver a safe maternity service in a regional and remote community, you have to have sufficient birth rates to keep that safety level. Many obstetricians, there has to be so many births per month, per year, for them to keep their skill level up in really small towns where the birth rate just cannot sustain that level of pipeline of skills that obstetrician needs. It is unsafe to provide.
But
that's what
isn't it less safe
obstetricians
for the
tell
baby
me.
on the highway?
Well, there's other measures that are put in place. There are many other measures put in place. We have the midwifery group practice, which came out of nurses and midwives and consumers, mums telling us what they want. So that practice that we have put in place in those more regional towns have come about because this is what the community and this is what the health workers say is a good model going forward, and it's a safe model going forward. Where someone is at risk or higher risk, there are measures put in place, including birthing mums at Chilla, where they will say, we can transport you, we can provide you accommodation, we can provide you with patient transport subsidy so that you can birth safely. Yes, that is away from home. We appreciate that that is difficult, but ultimately, isn't it about keeping mum and baby safe and having a safe delivery?
One of the issues we've had in Gladstone and places like Billawheeler is staff have, been offered locum contracts and that kind of thing over the past 6, 7, 8 months, however long it's been going on for now, and they've pulled out before they've actually started.
Right.
How do you stop that from happening?
Look, those are conversations that we had with all the health ministers last week, both the the amount the locums are charging is extraordinary, absolutely extraordinary. In fact, you know, we've had circumstances where, you know, we were negotiating with locums, there was media reports, and then we got a phone call saying our fee just went up from the media reports because they know that they're in demand. I find that quite unconscionable, to be honest, that is happening out there. But that's the reality when they've basically got a captured market and they know that we need them. So, you know, we will continue to work with these agencies. We're seeing, you know, doctors leaving to work as locums. We're seeing nurses and midwives leaving to work as locums because they earn a lot of money. But I'm hoping with the wage offers we've put forward and some of the other initiatives and remuneration we're offering up in our enterprise bargaining agreements in Queensland, that it will be enticing for these health professionals to come work for us. But it is a struggle. It is frustrating. We get, you know, we offer a job to a locum and it could be as little as 24 hours before they're due to arrive or to start on the job. They say, I've taken another job because they're offering more money. It is a bidding war out there and it's quite brutal.
The Family First Medical Centre in Harvey Bay's put a petition to Parliament talking about exemptions for GPs to the payroll tax. It was sponsored by the clerk.
There is already an exemption. There is already a delay. The Treasurer has announced that. So, you know, that's already been dealt with by the Treasurer.
Well, camp lease is about to run out. Any thoughts on that?
Look, Wellcamp is a really important facility that we needed to commit to because the Commonwealth at the time did nothing to help us with quarantining people who were at risk of having COVID, which would have meant Queenslanders would have been exposed to COVID prior to our community getting vaccinated. We did what we needed to do, and in fact the Commonwealth came very late to the party and then went and built Pinkenba, which, you know, to right up till today has never been used. So, you know, that is a great facility. I have no doubt it will have many uses going forward. And it was the right decision we made at the right time because the Commonwealth refused to step up and do what they should have done.
But only about, I think, over 70 people have actually used the facilities.
There's other people that have used the facility as well, not just COVID. It was offered to Ukraine migrants coming in. It was offered to flood victims over the border when those awful floods happened last year. It's been offered in a number of circumstances. Most recently, it was being considered, you know, as far as cyclone and needing to evacuate people. So it has many uses. And as I say, it was certainly built because we needed to, the hotel sector was stepping back. And we needed an additional facility because no one could have predicted exactly where COVID was going to go, how long we were going to need to isolate and quarantine people coming over our borders, and the Commonwealth just failed in every possible way when it came to this.
What's the latest thinking now about what it'll be used for?
As I say, those are decisions that I know the State Development Minister will make along with the Wagners, but it's a great facility, and as I say, I have no doubt it will be used well into the future.
Thank you.
Thank you, everyone.
Put that on.